Hello, Bloomington. I'm Mayor Tim Busse, and this is the Council Minute for the week of August 28th. At our council meeting on Monday night, I read a proclamation recognizing August 31st as International Overdose Awareness Day. The proclamation underscores the toll of drug overdoses in our community, our state, and our nation, and the importance of local resources for prevention, treatment, and recovery. As they are on many significant topics, our Bloomington Public Health Division is a leader in the response to this issue. Bloomington Public Health is collaborating with stakeholders across Bloomington, Edina, and Richfield to address opioid prevention, rapid response, and treatment needs across the three cities. This opioid work group has identified key objectives and actions in a new work plan, which was presented to the Council on August 14th. Joining me today to talk about this is Dr. Nick Kelly, the Director of our Public Health Division here in Bloomington. Thanks for being here today, Dr. Kelly. We'll get to you in just a moment. Similarly, the public safety professionals in our Bloomington Police Department are also working on this issue, very often on the front lines. I'm happy to welcome Deputy Chief Kim Clausen today to offer a public safety perspective. Thank you for joining me today.
Yeah, thank you, Mayor.
Dr. Kelly, let's start with you. Tell us more about International Overdose Awareness Day.
Thank you, Mayor. International Overdose Awareness Day started in 2001 in Melbourne, Australia, and it's since grown globally due to really the significant impact we've been seeing with overdoses with opioids around the world. Here in the Twin Cities Metro, we saw 340 fatal overdose cases in Hennepin County in 2021. And here in Bloomington, our public safety partners and police and fire, they responded to almost 80 overdose calls in 2022.
That's a disappointing and a huge number. That's amazing. Deputy Chief Clausen, as I mentioned, Bloomington Police are on the front lines on this opioid epidemic issue and many times have just moments to respond in critical situations. Tell us about how many times do Bloomington police officers respond to overdose situations and what is the typical response?
Yeah, Mayor, unfortunately, Dr. Kelly is correct that we responded to a large number of overdoses in 2022, specifically 77 of those. And of those, we saw the highest fatality rates that we've seen previously with 19. This year, we are seeing overdose rates as well. Currently, we're at 61 overdoses with fatalities in 7 of those cases. What we do which 7 out of 61 is a horrible number, but we also have been able to use Narcan in 58 of those cases. So an officer will respond. What we want is for the public, if they see someone who's unconscious or someone they think is overdosing, definitely to call 911. There has been legislation passed back in 2014 that offers limited immunity to people who do seek help for suspected narcotics overdoses. So the 911 call is the first step, the most important step to get those medical first responders to the scene. And then typically we will evaluate if someone is unconscious. Narcan is usually administered. So we've had a good success rate with that, and we want to continue to do that and continue to educate people in how successful Narcan can be.
Well, that's fantastic. Thank you for your work, and be sure to thank your officers for their work on this important issue. Dr. Kelly, the city was part of a settlement and received funding regarding the opioid epidemic. Tell us how that money is being used and the work of the work group, the task force that's underway.
Yeah. So in 2021, the Minnesota Attorney General became part of a settlement with manufacturers and distributors of opioids. That is resulting in about $3.5 million coming to the cities of Bloomington, Edina, and Richfield that we pulled together a work group of key stakeholders, partners, our public safety partners, our school district partners across those 3 cities to work on how we're going to respond and do some innovative work to address the opioid challenges we're facing in our community. A lot of that work is being driven by this work group, really focused on some education, some resource allocation, and really supporting those systems there and really making sure that when BPD has those successful recoveries with Narcan, that there's resources and capabilities to support somebody in their recovery journey.
Wonderful. So finally, what can members of the Bloomington community do to both learn more and to respond more when they see opioids in their family, in their community, and people who might be needing help?
I think one of the biggest things to do is understand what's going on. So we have great resources on our city's website. It's blm.mn/opioids. That is a great place to understand the resources, the data, the tools. And as Deputy Chief Clausen said, call 911. If you suspect that, get help immediately. It is an urgent, rapid response that's needed.
This is a critically important issue, and one that is certainly challenging in so many ways, but it's reassuring that we have skilled and compassionate professionals in our public health and our public safety areas who are working hard to save lives here in Bloomington and beyond. Dr. Kelly, Deputy Chief Clausen, thank you very much for being with me here today.
Thank you.
Now it's time to answer your questions about Bloomington Forward, the long-term investment plan that, if approved by voters, would support 3 major community projects for better health, wellness, athletics, recreation, and improved natural areas. On November 7th, Bloomington voters will consider a 0.5% local option sales tax to finance $155 million in bonds to pay for the projects as part of a citywide referendum. The questions on this fall's ballot will ask voters about the following projects. Ballot question number 1 asks voters about building a new community health and wellness center to replace the outdated Bloomington Public Health and Creekside Community Center buildings. Ballot question number 2 asks voters whether they would approve renovating the 50-year-old Bloomington Ice Garden, including new refrigeration and mechanical systems, improved ADA accessibilities, a new roof, and additional improvements to improve guest experience. And ballot question number 3 asks voters about enhancing and protecting the 9 Mile Creek corridor and the Moyer Central Park area with restored riverbanks, habitat protections, improved trails, and new park amenities to support outdoor recreation. If approved, 67%, that's 2/3 of the local sales tax revenue, will come from non-residents, according to research by the University of Minnesota. By using a sales tax instead of a property tax to solely finance these projects, non-residents would share in the cost of paying for them when they patronize local businesses. All of that leads us to this week's questions. Our first question: does the new sales tax rate depend on how many questions are approved by the voters? The answer is no. The sales tax rate is the same no matter how many questions are approved by the voters. The tax would be 0.5% total if 1, 2, or all 3 projects are approved by voters in November. If none of the projects are approved, there will be no sales tax. The sales tax would end when the approved projects are fully funded. The maximum term for the sales tax is 20 years. If just 1 or 2 projects are approved by voters, the sales tax will still end when the project or projects are fully funded before the maximum term. Next question: how will the sales tax impact Bloomington residents? The average cost of the 0.5-cent sales tax for Bloomington residents will be approximately $94 per household each year, or $7.86 per month. If the projects were funded solely through property taxes, the property tax bill for a median value home would increase by $223 per year, or $18.60 per month. And what about possible economic impacts on local businesses? The University of Minnesota analyzed the economic effects of a local sales tax increase in several cities and found that overall, sales growth for businesses would not be impacted. And our final question this week: when would the sales tax be implemented? If approved by local voters, collections of a sales tax would begin sometime in 2024. There are still steps that need to be taken, including an ordinance that would need to be adopted by the City Council. As I mentioned earlier, the tax would expire in 20 years, and if the bonds for the projects are paid off before then, the sales tax would expire earlier. The only way the tax could be extended is with legislative authorization and reapproval by Bloomington voters. I'll be answering a couple of questions each week leading up to Election Day. So be sure to tune in next time for more answers to your frequently asked questions. In the meantime, there's much more information on the website bloomingtonforward.org. And finally today, it's hard to believe that school has started already. Where did summer go? I know that Normandale and Northwestern Health Sciences are already well into their fall semesters, and Bloomington Public Schools started on Monday. I had the opportunity to join Superintendent Dr. Eric Melby welcoming students as they arrived earlier on Monday. It was a lot of fun. Students, teachers, parents, staff, bus drivers, administrators, everybody who makes all of this work, have a great school year. That will do it for this week's Council Minute. Thanks for joining me today. Have a great Labor Day weekend, folks. Until next time, stay safe, Bloomington.